Wonderful. Thank you so much. Just to make sure you guys can see my slides, correct?
Yes, we can see your slides. Thank you.
Perfect. So thank you for inviting me to be here today. I'm honored and really excited to talk to you guys about something that is really exciting to me and that I'm really passionate about. So the reason I'm even here talking to you today about bimodal hearing for adults and its potential benefits is really in part because the candidacy criteria for both children, but I'll focus on adult cochlear implantation, has expanded significantly over the past 30 years. Previously, when cochlear implants first became a treatment option, really only individuals who were adults, post-lingually deaf and had bilateral profound deafness would be considered a candidate for a cochlear implant. Today, this is really the standard adult cochlear implant criteria. And now, because the criteria has expanded to include individuals with less severe hearing loss, many of these individuals also present with aidable hearing in the opposite ear or the contralateral ear to the implant. So I'd like to preface this talk by stating that the hallmark of cochlear implant outcomes is variability. Today, I'm going to really focus on the benefits of cochlear implantation, particularly for individuals who utilize one cochlear implant and a hearing aid in the opposite or contralateral ear. And throughout this presentation, I want you to remember that one size does not fit all. That is, not all individuals will benefit from bimodal hearing. And if you utilize bimodal hearing, not all individuals will benefit from this mode of hearing to the same extent. So there are a lot of individual factors that help to impact success. Some of these can be controlled by the user and some of them cannot be. So what is bimodal hearing? So bimodal hearing is a term used to describe the hearing profile of individuals who utilize one cochlear implant in one ear and a hearing aid in the opposite or contralateral ear. This type of hearing will provide the individual user with inputs to both ears. As Dr. Gordon stated, there's been a lot of research around the world and right here in Madison, Wisconsin, in Dr. Latofsky's lab on importance of input to both ears and how we think that can help in certain listening situations. So when cochlear implantation was a relatively new concept a number of years ago, bimodal hearing was actually discouraged. And this was because we didn't know how the brain would meld and unite these two really different signals. So electrical signal from the cochlear implant and an acoustic signal from the hearing aid. However, over a number of years, research has really shown that there can be a clear advantage for bimodal hearing over listening with a cochlear implant alone. So I just wanted to give you a schematic of what these very different signals are bringing and how amazing the brain is to be able to unite them and meld them together. So how does this work? Well, the hearing aid is really going to just provide an amplified acoustic signal. And if you talk to somebody who uses this hearing profile, bimodal hearing, they'll often describe the hearing aid provides them quality of sound, overall balance of sound. And the cochlear implant is going to provide the electrical sound to the brain. And we are taking, with a cochlear implant, we're taking away the fine structure information in an acoustic signal and replacing that with electrical pulses that are delivered to the auditory nerve and ultimately recognized as speech in the brain. And if you talk to a bimodal user, typically they'll say that the cochlear implant provides them clarity and crispness of speech. And then the most amazing part here is over time, for many individuals, the brain will work to integrate these signals into one auditory image or to one sound. And it does this by really extracting the most useful information from both that hearing aid, the acoustic signal, and the cochlear implant, the electric signal. Now, this takes time. It takes a different amount of time for each individual, but together, in the end, the goal is that you're getting some useful input from each of these devices, and it's combined into one. So you may be thinking or have thought, why would you listen with these two very different signals if in fact you could potentially benefit from two cochlear implants where the brain is getting two similar inputs? So there are a variety of reasons why somebody might choose bimodal hearing over bilateral cochlear implantation. And one of the main reasons, again, goes back to my first slide in discussing expanded candidacy criteria. So one ear may be better than the other, and the opposite ear to the cochlear implant may have good, usable, aidable hearing. Additionally, there might be medical or surgical limitations where an individual can only get a cochlear implant in one ear. There might be patient preference. It's not an easy decision to pursue a cochlear implant. And there are some limitations of cost, or insurance may only cover one. So there have been numerous studies over a number of years really showing that bimodal hearing can be beneficial, and specifically beneficial for situations such as being able to localize or tell where a sound is coming from. Additionally, research has shown that bimodal hearing can be a benefit in more complex or noisy environments, more realistic environments. Patients often report a benefit in perceived music understanding with the bimodal hearing versus with the cochlear implant alone. And often bimodal patients will describe hearing sound to be more full and have a better quality when they're wearing that hearing aid versus when they're not. So I'm just going to share with you some evidence for what I just said. There's a relatively new study that shows exactly what I just described. So really, in this study, we have individuals and they were asked to repeat sentences in background noise. So the y-axis here on the screen represents the relative speech to noise ratio that was tolerable for individuals in each condition, with the cochlear implant alone, with the hearing aid alone, and then listening bimodally. So really what you need to pay attention to in this graph is that lower is better. This data did in fact reveal that on average, listening in noise was easier in the bimodal condition rather than with one ear alone. And in general, the evidence shows, and it is thought, that really bimodal benefits or benefits of having that hearing aid in the contralateral ear are largest in more complex, noisy environments. So I'm going to share with you one more graph from the same study. And in this task, the individuals were asked to repeat words in quiet. So no noise in the background. Here I'm making you reverse what I just told you, and that higher here is better. So on the y-axis, we're looking at percent correct, word understanding in quiet. And here again, we're looking at data from the cochlear implant ear alone, the hearing aid ear alone, and then bimodally. And again, this data reveals that in general, on average, individuals, even in quiet, were able to benefit from bimodal hearing. So this may suggest a couple of things. One, that hearing aid ear is not interfering with the speech clarity of the cochlear implant. Additionally, individuals are getting 2 looks at this same signal when you're listening with 2 ears. So lastly, I want to show you some very hot off the press, very preliminary data that we are in the process of collecting and analyzing. So this data that I'm going to show you here includes 26 bimodal users. And I'm really interested in investigating not only speech understanding for bimodal users, but also subjective information. So do patients feel like they're benefiting from the hearing aid, and particularly when they're out of the clinic space in the real world? So for this, we asked patients to complete a questionnaire on how well they feel they're hearing in real world environments. So again, on this graph, higher is better. And we asked a series of questions. This is a standardized questionnaire. And it asks, basically, how well do you feel you hear? And we are looking at this longitudinally, pre-cochlear implantation and throughout the first 12 months after activation of the cochlear implant. So here I'm just going to show you pre-cochlear implant, 3 months and 6 months. However, we're going to be looking at this longitudinally. So I'm just going to be showing you subjective data from patients, but we're also going to be comparing this to speech understanding data that we're obtaining both in quiet and in noise. So here we see over time from pre-cochlear implantation to as soon as 3 months post-cochlear implantation, individuals are rating that they hear better in real-world situations. One thing I want to point out here is that ultimately we want to use this data to predict bimodal benefit for each individual. So it may not be the answer for everyone, but who will benefit from bimodal hearing, and also knowing that it takes time. So in summary, I want to leave you with a few things here. So the brain can work to integrate signals from the hearing aid and the cochlear implant, which is amazing in and of itself. However, there's still more research needed to determine what individuals benefit most from this bimodal hearing and to what extent, and particularly in the aging population, as much of this research on bimodal hearing has come from younger individuals and individuals who we assume have a more plastic brain. Additionally, bimodal hearing can provide advantages over listening with one cochlear implant, and this particularly comes out in more challenging listening environments. However, I want you to remember that one size does not fit all, that we really need to continue to think about individual success and individual treatment plans. And lastly, obtaining not only that objective speech understanding information, but listening to the patient and obtaining subjective information is really the gold standard in developing these plans, understanding that it's a marathon and not a sprint, that improvement continues to happen over time, and it takes work and effort. So I want to leave you with some advice from a recent new bimodal patient that I saw in the clinic, and his advice to future and current users and was the 3 Ps. This was his mantra: patience, practice, and perseverance. So thank you for your attention. This is a typical night at my house with my 3-year-old daughter, who has a mom as an audiologist and hearing scientist. So thank you.